our decisions that we have to make moving forward, we are looking at many factors. It's not just one factor as we move forward, and that's what we want to talk about tonight. So the next slide, if we could move to the next slide, is something everybody's familiar with, the PA Department of Health, what I've called guardrails, and with our most updated data. We've been updating this each week. The health department updates this every Friday for Delaware County, and they post it every Friday. So you can see where the numbers are, where the percent positivity and the incidence unfortunately have been on the rise. So this is the PA department guardrail, if you remember, that gives a low, moderate, and substantial, and that cutoff of 100 incidences for, when we look at the incidence cutoff, and then when we look at the positivity, you can see where the cutoffs are for positivity. If you go to the next chart, we have the Chester County Health Department guardrail. So again, the state provided us a guardrail and the health department, and just for those who may just be tuning in for the first time, the Chester County Health Department is working with both Chester County and Delaware County as we go through this pandemic. They are the health department we are working with directly. And they provided us with guardrails of low, moderate, high, and very high. And these are what we used, again, to help guide us in opening. And we continue to follow these very closely. And again, you can see, unfortunately, with the very high cutoff of 80, this is the first time we've been above that, in the last 3 months that we are at 93.5. So we are concerned about what we're seeing in the spread level we see in the county. If you go to the next slide, we also have the health department has provided, it's not our school district as if just school incidents, it is the district boundary and what's happening in the community of Radnor. So what's happening in the community of Radnor incidents, you can see that as well. They take that number each year, even though we have 30,000 residents and incidences out of 100,000, they convert that each week when they look at that. And so we're at 44.2. That's not a school district as in just the students and staff. That is a community number. And then you can see again the concerning piece where we are with Delco. We can move to the next slide. Go ahead. And then we've been tracking these same charts. So we put 3 of them together. I know they're hard to see, but these are on our website. But this is those same information from the last couple of charts. But just as, we joke that it's the Radnor constellation with the one, you can see how everything's moving. But you can see where we've been and the importance of trend data. What we are trying to see and the importance of the trend data is what's significant. We don't want to make a decision based on just 1 week's worth of data. We want to look at the trends. And that is something that the school board has been discussing and emphasizing, for months now, the importance of looking at the trends. And these charts are giving us that opportunity to look at the trends. And it is concerning what we see now and where it is trending and where it is heading. And we're going to continue to watch that. And you can see that it very clearly shows here that our incidence is now in the red. And that is what has prompted, the Delaware County incidents being in the red has prompted, I've received many emails where people are asking, isn't it time for us to go back to phase 3? Is it time for us to go virtual based on this incidence now that has gone up? So that's something we want to talk about tonight and put that in context. And again, we continue to learn and we're continuing to adjust the information as we move forward and as we learn more, both from the medical community, as we learn from the health department, as we continue to meet with them weekly. So if we can move to the next slide. So what are those implications? And is it time for us to move back to phase 3? And what would make that decision? And I want to also be clear and reminder for our community, but also for our school board is well aware, but our board and community, that we made a decision as a board. We made a decision that the administration now, has the authority to move us between these phases. So it is the administration could at any time decide that we need to move back to phase 3. And I've been I've been saying to people that could happen at any time. It would most likely happen because it's in consultation with the health department and it's a recommendation from the health department would be most likely. But as administration, we could decide on our own that we need to move to phase 3, or there could be some type of information or data. The administration can also now make the decision on when it's time to move us to phase one. And we're continuing to, as we talk about now phase three for a moment, we're going to spend some time after this talking about what does phase one look like as well. So is it time to move back to phase three? So even though you just saw us in red in that last chart, I want to share with our community that what is going to guide us are four factors moving forward. So those metrics and guardrails are still going to guide us and are still important. But what also is critically important now that we've been open for 5 weeks in hybrid, is our experience. Our experience is going to play into this discussion now of when we may need to move to phase three or when we may need to move to phase one. And our experience right now is telling us that we don't need to move to phase three. So even though on this first quadrant, the guardrails are suggesting it, our experience right now is not suggesting that we need to move to phase three. The other two factors that are going to be part of this for us in any decision is logistics and staffing. And you're going to hear tonight again about the substitutes and what it's taking for us to be open each day. The logistics we have when it comes to transportation, when it comes to lunch, the logistics that are behind each one of our phases are going to play into any decisions we make. And social distancing guidelines, we put that as its own standalone, and I'm going to explain a little bit more why that's a standalone. Even though mitigation strategies are supposed to be a comprehensive strategy, and it's not just one mitigation piece we should lean on, it's a comprehensive approach to mitigate the spread. There is one that weighs heavily on us as we look to try to make any decisions moving forward, and that's that social distancing. That is the reason we're in hybrid. One of the biggest reasons we're in hybrid is that social distancing. So based on these four areas, is it time to move back to phase three as of 7:43 on 10/27? No. Could that change tomorrow? Could it change in a week from now? Yes. I think I think I have to say it out loud for myself, because as much as I think that we say this a lot, that we get where, we realize that change is here. Change could happen at any time. But based on our experience, and we're going to share a little bit more now about our experience, we don't believe we need to be moving to phase three right now. So what is that experience? So if we could move to the next slide. And before I even talk about our specific experience, let me just share also what's coming. What are we learning from the medical community? Recent New York Times article, school children seem unlikely to fuel coronavirus surges, scientists say. Again, based on schools being open. Now that schools are open, whether it's in hybrid or they're open full in person, we are gathering more information. So we wanted to share this article, and in this article is also quoted Dr. Rubin from the Policy Lab, and we have information here. The Policy Lab has given us an update. And in this update, the Policy Lab shares with us that those guardrails that were created to decide whether it was the right time to open or not, now that we're open and we have protocols in place and we see that the protocols are being followed, now that we know we can contact trace, and we've been doing it, and we've been contact tracing when we have incidents, we can look at those guardrails a little differently. And so that's what this Policy Lab document is suggesting to us, among many other things, is that our experience, that second quadrant I talked about, our experience should play into that decision and shouldn't lead us just because we see trend data that is rising. Now, there's going to be a point where that community spread data, and the Policy Lab even talks about a 9% positivity being very concerning. There is going to be a point where that community spread information may start to outweigh and tip the scales. But right now, because we're open and what we're seeing, it's not tipping the scales for us to move back to phase three. If we go to the next slide, this is our, between September 6th and October 14th, this is what Radnor has been experiencing as a school district. And so what we're sharing with you, and this is just from September 6th to October 14th. And I can even tell you that this data has changed just even as recently as last week. I know of an additional case. So some of this data, when we share it with you next month, will be different. But just looking at the snapshot of September 6th through 10/14, you can see what are our number of positive cases we've had within the district, the number of quarantines from outside exposure, and the number of quarantines from school exposure. we are, whenever we have a situation, we're working closely with the health department on who we should notify and when we should notify. And the health department works very closely with that. All of this data is, now you have to realize, is based on what we know as a school district, what is either reported to us, whether it's something we have discovered, and then it is in working with and confirmed with the health department as we move forward. So we wanted to share this data so our community could see where we are, and each month we will continue to share this information. As we have been saying as a community, we're going to have spread and we're going to have situations where we have exposures in school. What's absolutely critical is our ability to contact trace, our ability to make sure that our mitigation strategies are being followed, because when our mitigation strategies are being followed, it then has implications as we work with the health department on to what extent do we even have to quarantine, depending on the circumstances. And every situation, if I've learned from the health department, every situation when they do their contact tracing, every situation is different. So we want to share that information with our community as we go forward. We will, each month have an opportunity to share the status of where we are as a community as we look at this. So the next slide, and before we leave, well, you don't have to go back, but just one last thing I want to mention on that last slide before I forget. We have to protect people's individual rights too. So we have to be very, very careful that when we're sharing information like that, or sharing information that students and parents aren't trying to figure out, oh, who is that student or who is that person? People do have privacy rights, and we want to be very, very careful and mindful of that. So I know the health department feels strongly about that, and as a district, we feel strongly. So while we want to share information like that last slide, we also want to make sure we are being careful and respectful of individual privacy as well. So we're not recommending, again, as of tonight, 10:27, still at 7:48, I'm still holding. So it's been a couple of minutes since last time that we're not going back to phase 3. But as again, that could change at any time. But how would we move to phase 1? And administratively, we've been talking about the fact that now that we're on week 5 of hybrid, we have to be prepared to move to phase 3, but we should be just as prepared to move to phase 1. And these 4 factors will play in our decision. So clearly right now in a move to phase 1, one of those factors, the metrics and guardrails, is not helping us. That data right now on community spread is not helping us. Our experience though as a district is helping us. Our experience and our students following the protocols and seeing that the protocols are being followed and are adjusting to it is helping us as we move forward. So the other considerations we need to talk about are logistics and staffing and social distancing. So in the next slides, we want to talk a little bit about what are those factors and what do those factors mean for us. So if we go to the next slide. So the guidance, speaking of that social distancing, the guidance from the health department and what does it take for us to transition, is a factor for us as we move forward. And again, the thresholds of community transmission and all of that is laid out in this document. In the next slide from the health department, the key piece in the guidance, and this is the guidance, and again, the guidance is updated. It's been updated, I think, 7 times, if I recall, and it's updated 7 times because the health department is continuing to learn, continuing to adjust based on the circumstances, based on what we learn, based on changes from CDC. We see that one of their requirements is the 6-foot distancing. One of the guidance pieces is the 6-foot distancing, but there is a piece in the guidance that says school districts, if there's evidence that exists for improvements, with cases, transmission, deaths, hospitalizations, schools may consult with the Chester County Health Department about transitioning to in-person with less than 6 feet of physical distancing. So we have started that conversation with the health department to understand what does this mean and what could it mean for us. As a school district, we feel that we need to be prepared and need to understand, and that as we as a district are seeing that our protocols are being followed, what does this mean for us? And how would we as a school district possibly transition to phase 1, knowing that 6 foot of distance is why we're in hybrid. In order for us to leave, there's a lot of pieces, but the big piece, and that's why it's one of those 4 factors, is that 6 foot of distancing. We could have all of our students back at 4.5 feet. So we need to look very carefully at this guidance. And this is the piece, one of the pieces that we have to make sure that the implications for busing and for also lunch are part of it. But again, this distancing of 6 feet versus 4.5 feet, it is our hybrid program, are bringing our kids in every other day. It's the morning and afternoon session that gives us the 6 foot of distancing during the school day in the hybrid program. So now that we're 5 weeks into it and we're seeing that our protocols are being followed, we want to understand now, what does it mean for us and how do we get to phase one looking at this guidance?